Hi, faculty. It's Laura again. I just had a couple of other things that I always keep thinking of new things. I'm sorry, but I wanted to just clarify a couple of other things about lab for next week when we do our skills. So, the directions for how to run those skills labs are in the practice workbook key, which is available in the module one. Um, in Canvas, but I wanted to go over a couple of particulars. So the people, whichever faculty is going to be running the emergency equipment practice, I want y'all to know there's going to be two stations because the students are broken up into groups of like 8 or 9 students, and having 9 students in one place is way too much. So you're going to want to break them up into smaller groups of 4 and 5 people. Um, but you're probably, because there's only one of you, I will be there and I will probably be helping you. But in case I'm not available or have some other things scheduled, you're probably going to have to go back and forth. Um, the students are going to be identifying those types of oxygen delivery devices and things. They do have the answers here for them already in their book, but they need to identify what those different devices are and things like that. You just kind of want to clarify with them if they have any questions. Um, and then this question here about discussing the difference between oxygenation and ventilation, they're going to need to kind of have that discussion with you about what's the difference. They need to identify that, ventilation is a respiratory thing, oxygenation is a cardiovascular thing where we're carrying oxygen to the rest of our body for perfusion purposes. Um, the other thing is students when they put oxygen on, they immediately look to the monitor to see if their O2 sats go up because they think that they're going to get immediate results. They need to understand that it doesn't quite happen just like that immediately, that sometimes you have to wait for those sats to go up. The other thing that I want to point out to you is here's where that simulation is where they're supposed to take care of the demonstrate care of the child having a seizure. This is where you want to watch them do rescue breathing after that seizure has resolved. Watch them do, and so you want to make sure that you watch every student do rescue breaths because they do not know how to hold the clamp and hold the seal and actually do rescue breathing without like blowing out somebody's lung. So make sure that you watch them, every student, do that. But the other thing that, and you're probably, if it ends up being just you alone, you'll probably have to go to one room, do this, do the sim, do the other, and then do it in the other room. The other thing I wanted to point out, because it's not actually on here, is there should be a nebulizer in each of those rooms. Have those students practice putting the nebulizer together and talk about how you actually administer a nebulizer because the students are not familiar with that. And there's going to be some simulations, particularly the oxygen simulation, the child with asthma, where they're going to have to actually give a nebulizer, administer a nebulizer, and they don't know how to do that. So please have them do that. The other thing I wanted to point out is, please excuse my scrolling, but down here in the medication administration room, um, so the IV, so the students are going to come already having done all of this work. They will have already done all this calculation, and they will have already done the prep work, knowing how to crush the meds, mix them up with the water, and be ready to administer the meds via the NG tube and the G tube. This station is not about you teaching them that. This is about them doing this stuff in green, actually practice, actually drawing it up, putting the med through the NG tube or the G tube, and then on the IV stuff, actually setting the pump. So your role is not to stand there and teach them that, but to let them get in there and do the hands-on stuff and do it. They may have questions like, I'm having difficulty setting the pump, or how do I hold this, or something like that. So you guide them through those steps, but it's not going to be you standing there actually teaching them the stuff. They should be spending their time literally doing the hands-on portions of these skills. Um, the meds, I think I did mention this, that the medications that they're giving here for example, the vancomycin, this concentration is not in the drug library of the pump. And so when they're setting up these scenarios, they'll just be setting them up as basic infusions, not using the drug library. So I do have some other scenarios set up here that they can use to practice setting up the pump using the drug library once they've finished the scenarios in their workbook. These are some additional scenarios that they can use to practice setting up the pump using the drug library, so they know how to set up the pump both ways, with the drug library and without the drug library. So if there's time left over for them, they can practice with these scenarios and just do as many as they can depending on how much time they have. So in that room, there again, we have an hour and a half for these rotations. So they're going to spend about 45 minutes doing the NG tube and the G tube and getting comfortable with that, and about 45 minutes doing the IV piggyback meds and the large volume medications and working with the pumps. So kind of try to guide them to divide their time up in that kind of way. So make sure that they have enough time to get through all of those skills in those rooms. And I think that was everything that maybe I didn't touch on when we did orientation. Thanks, you guys. I'm looking forward to next week.